Hello, everyone, and welcome to another episode of the Fibroid Doc, where I am committed to helping women with fibroids live a life with reduced bleeding and pain and improved fertility. Today, I'm going to tackle this important question of fibroid symptoms. Is it my fibroids, or could I have ovarian cancer? This is a common question asked by many patients. Maybe you're feeling a little bloated, maybe you're feeling that, your pants are a little bit tight, can't quite button them up like you usually are able to. You're feeling like your belly is getting a little bit bigger, maybe you even see a mass there, like a ball. You're able to feel something hard. And, as women, a lot of us are very nervous about ovarian cancer because there's no good screening test, there's no way to really detect it, and oftentimes by the time it shows up, it's too late. It's a really late stage cancer on presentation. So a lot of women that I see are very nervous about that, understandably so. And so when you start having these symptoms, you're thinking, could this be a fibroid? Or, oh my goodness, is it ovarian cancer? So how do you think through this? Okay, so I want to go over a few things, and I have a few thoughts about this particular topic. So let's first talk about how common fibroids are and how common ovarian cancer is. Okay, so the incidence or prevalence of fibroids, I should say, is high. So by the time you're 50, you have about a 50 to 60% chance of having a fibroid. And if you're a woman of color, particularly African American, that number jumps to 90%. Okay, so fibroids are really common. They may not be causing a lot of symptoms for some patients, but overall, they are super common. Ovarian cancer, the lifetime risk of ovarian cancer is 1 in 70. So that's 1.4%. And a lot of women have actually used birth control for many years. So a neat fact is that if you've used birth control for over 5 years, your risk of ovarian cancer is cut in half. So from 1 in 70, it actually goes to 1 in 140. So point number one, common things are common. So fibroids are actually way more common than ovarian cancer. So if you are having these types of symptoms, you should definitely see your gynecologist and definitely get checked out. But something to think about is, the chance of having a fibroid is way more common than it being ovarian cancer. Okay. Then the second point that I wanted to mention is that the symptoms can actually, a couple of key symptoms can help you differentiate it. Okay, so the bloating, the mass, the kind of weight gain, unable to button your pants fully, these could be actually either fibroids or ovarian cancer. But if you're having very heavy bleeding to the point of clots and severe pain during your periods, that is more likely to favor fibroids. So those are two things that ovarian masses don't typically present with, okay? So heavy bleeding, clots, pain during your period, that favors fibroids. So that's another key point to think about. And lastly, and the third point that I want to mention is that an ultrasound can quickly differentiate a mass of the ovary versus a mass of the uterus. So fibroids are tumors of the uterus. So an ultrasound can, when you do an ultrasound, you can see, oh yeah, this is actually a fibroid. It's growing right on my uterus, in the wall of my uterus or on top of my uterus. Whereas if it's ovarian cancer or a mass of the ovary, it's gonna be either on your right ovary or your left ovary. Okay, so that's a pretty quick test. It's not very invasive, or it doesn't take a lot of time, and that's a quick way of telling whether it's a fibroid versus an ovarian tumor. Okay, so just to recap, firstly, fibroids are way more common than ovarian cancer. Number two, the two main symptoms that can help favor a fibroid is the severe bleeding with clots and pain with your periods. And number three, an ultrasound is a quick way of just figuring out whether it's a fibroid or an ovarian tumor. So I hope you found this video helpful. If you can think of a friend that may also find this helpful, please tag them. Please subscribe to my YouTube channel, TheFibroidDoc, as well as follow me on Instagram at TheFibroidDoc for more helpful videos and information on fibroids. Have a great day, everybody. Bye.